Hello, I'm Dr. Christine Anderson, and I am a chiropractor in Los Angeles, and I am also a homeopath. And I want to come on tonight and talk about the basics of homeopathy. So, essentially, Homeopathy 101. What is it? How does it work? Who can benefit from it? And how to use homeopathy to help have in your healing wellness toolbox in case certain things occur. And I'm going to talk more about how to do that. So let's dive right in and talk about what is homeopathy. So you can see there the father of homeopathy, Samuel Hahnemann. He was from Germany. And he was practicing medicine before he developed this concept of homeopathy, which in 1814 it was when it was officially brought out to the world, especially in Europe. And he called it homeopathy because of homeo, meaning similar, and pathy, meaning suffering or disease. So this means it is a remedy that's used that is similar to the disease, and I'm going to talk a little bit more about that in a second. It's actually the second largest therapeutic system in the world, and the definition is the treatment of disease by minute doses of natural substances that in a healthy person would produce symptoms of disease. Now, if that's confusing, I'm going to talk a little bit more about that in a second. But the way he came up with this concept is that at this time, in the early 1800s and the latter part of the 1700s, the way medicine was practiced was very, we would consider it barbaric. It was bloodletting. It was using things like arsenic and other toxic substances. And often the quote-unquote cure was worse than the disease and often killed the person. So Hahnemann was a little bit, he wasn't finding his practice as a medical doctor very satisfying because of this. And he was looking at, he was doing some research and looking at the fact that someone was talking about cinchona, which is another name for quinine, and how they were using this to treat malaria. And so what he theorized was that if he could take this substance that created actually more malaria-like symptoms in him. So he started taking full-on cinchona bark or quinine bark and was creating malaria-like symptoms in his body as a healthy man. He did not have malaria. And he theorized that if he diluted the quinine quite a bit, that it would then be able to help the body heal from malaria. So we're going to dive in a little bit more about what this all means in a second, but just again to back up and give you a broader picture about homeopathy. Number one, in general, it is very safe, very gentle, very natural, and it works with the body as a healing modality that is very useful in trying to minimize the toxicity of, say, like a drug that you take always has side effects. In this case, it is not usual to have a side effect. I'll talk a little bit about if you take too much too often, but if you stop it right away, it won't have any long-term effects. So number two being its safety. It's really safe. This is something that I use with my pregnant patients, my little babies, young children, athletes who might not be able to use certain pharmaceuticals. so safe to use because of this dilution factor we're going to talk about. It really does not have any side effects that conventional medicines have. It's very, very affordable. And again, it's made from natural substances that you find plants, animals, minerals, that type of thing. Number 4, there are thousands of positive outcomes when we've done clinical studies, and I'm going to dive into that a little bit more. Number 5, homeopathy has been shown to be clinically effective in over 200 years of use in both acute and chronic conditions. So a lot of things respond to homeopathy because you're just stimulating the body's natural healing modalities, and the body has everything within it to heal itself. Number 6, homeopathy is a federally recognized form of medicine and regulated by the FDA. So this is not just some type of therapy that hasn't had any history behind it, as you can see. All right, let's go into this law of similars a little bit more. So the theory is like cures like. What does this mean? Well, when I'm cutting onions, my nose runs, my eyes burn, my nose burns. Those are the symptoms that are created when I'm cutting an onion. Now, if you are having, or if I'm having some sort of colds, symptoms with a runny nose that's burning and irritating, allium cepa, which is homeopathic onion, would be a remedy that would be able to help with the symptoms I'm experiencing. Now, homeopathic belladonna is another example. So belladonna is deadly nightshade. And if you take deadly nightshade, which is a plant, and I talked a little bit about this when I was talking about homeopathy for fevers, and I'll put a link to that in the description, because belladonna is a great remedy for a fever that comes on suddenly. It's really hot and high, and there can be a lot of redness and sweating and same type of things that would occur if you consumed deadly nightshade. But in homeopathic form, it is diluted so that there is basically no belladonna molecules in there once you get past a certain dilution. And so that's why it's safe, where it's telling your body, hey, can you address these things here and heal yourself in the homeopathic form? So the idea is to tap into your own body's healing mechanisms by bringing attention to where the healing needs to occur. So this is how I kind of think about it. The homeopathy goes, excuse me, could you please pay attention over here and take care of this matter? It's a gentle nudge. It is not by any means it's very gentle and just a subtle hint that things need to occur. Herbs that are natural are full strength, but they're a little bit more aggressive, as they're more of maybe a shove. And then allopathic medicines are more of a bulldozer effect, like whether you want it or not, here it comes. So this is very, very gentle in the approach to the body of what it needs to do to heal. So while we're talking about this aspect of homeopathy, using it as a healing modality versus what we call allopathy, which is the traditional medical model. So with homeopathy, and this is very similar to chiropractic, but I'm going to stick with homeopathy, symptoms are messages. They're actually the body doing what it needs to do to heal. So your nose is running when there is something irritating it. You might have diarrhea if you have eaten something that is irritating to your digestive tract, and it is trying to get that poison out of there. Your fever is a symptom that there's a reset of your temperature when something has caused that, whether it be bacteria, virus, toxin, etc. And I go into that in all about why I love fevers. So I'll put that in there too. But it's basically messages. The body is trying to mount a response to something that is going on in it. And we want to make sure we're helping that healing process and not stopping those symptoms. And in homeopathy, you're actually basing which remedy you give on the particulars of that symptom. So it's not just, say, vomiting, it's what type of vomiting and what makes the vomiting worse and what makes the vomiting better. So it's a very detailed looking into which particular remedy is going to help with those particular symptoms. And it also even brings into the personality and the emotions of the patient, their likes, their dislikes, and all of that. It's not a simple one-size-fits-all program, like everybody gets the same remedy if you're vomiting, or everybody gets the same remedy with a fever. Is it a low fever? Is it a high fever? Are you red? Are you thirsty? Are you not thirsty? All these things have to be taken into consideration. Now with allopathy, what tends to happen is symptoms are looked on that they must be stopped at all costs. We've got to lower that fever. We've got to stop the diarrhea and vomiting. We've got to, shut down whatever the symptoms are. We've got to stop those. And that's what the medications really are designed to do. And you'll see a lot of anti in front of them, front of the name. So, an antiemetic, that type of thing. Let's talk a little bit about antibiotics. So if you take an antibiotic, which is only going to help if there's a bacterial infection, and if you're not having one of those, it's not going to help at all, and it's going to make things even worse. But even if there is bacteria, if you take this strong drug, it's going to destroy all the beneficial bacteria in the gut. That's going to weaken the immune system because a lot of the immune system occurs in the gut. So in the end, this person may end up with more frequent infections or atopic disorders like allergies, eczema, asthma, that type of thing. And even a chronic condition might occur if there is very big damage to the gut, where things get through into the blood and you start reacting against your body. And as a case of autoimmunity, that might occur where rather than helping the body heal, you're creating more destruction and more dis-ease in the body. So this is the difference between homeopathy, where we're honoring the process of the healing, the symptoms coming up, and using them to help figure out a remedy, versus trying to stop those symptoms from occurring at the cost of what the body's natural process is. So let's just delve into a little bit about the uses of homeopathy. Basically, you can help every single system in the body. And there is a little book called the Materia Medica, which is basically divided up into the systems of the body. So if someone, has a runny nose, you go to the nose section and go down and look at runny, and then they'll be like, is it clear? Is it, cloudy? Is it green? Is it burning? And so it kind of breaks it down from there. But in general, looking through the research and looking at different things out there, the common issues that we have with our bodies that are responding to what's going on in the environment are going to be things like colds and flus and fevers, otitis media, which is ear infection, the allergies, asthma, eczema, skin issues, Any trauma, physical trauma, really responds so great to a remedy called Arnica montana, especially if there's bruising, joint and muscle pain, anxiety, depression, and other emotional issues. There's research that's going on ADHD and autism and how homeopathy can help. And again, there's no one size fits all. There's not an autism homeopathic remedy. It's what are the symptoms that that autistic child or person is exhibiting. Digestive issues, including things like colic in babies and, like I said, nausea, vomiting, and constipation and diarrhea and that type of thing, irritable bowel, headache, migraines, and aiding in the body's detoxification process. So many things, and how homeopathy can be used in all of those. All right, so how is homeopathy made? Like I said, plants, animals, and minerals are used in the process. First, a mother tincture is made by mixing 1 part of the substance to 9 parts of alcohol. And then from there, depending on how you are making the remedy, whether you are diluting it with 1 part of the mother tincture to 9 parts of distilled water, that would be an X factor or the factor of 10, or a C potency, where you're mixing 1 part of the mother tincture with 99 parts of distilled water. That's how it gets the C potency. And each time you do that, you are increasing the potency. So you are going to see on your remedy bottles, let me see, I have here's Ledum palustra 30X. All right, so it's 30 times they mixed 1 part to 9 parts. And as you see with the C potency, if you do 30C, it's 1 part substrate to 1 plus 60 zeros of water. So every time you dilute it, it's exponential until really there's going to be a point in the mixing where there's actual no substance left. For any of you who remember Avogadro's number, it's like 6.02 times 10 to the 32 or something like that. Don't quote me on that, I may be wrong. But once you dilute it, there's actually no substance left in here. So this really becomes very confounding for people who are like, well, but how does that work if there's not an actual substance? So really, what is going on is you're not just diluting. As the remedies are diluted, there's a potentiation going on where you are infusing the therapeutic energy, the frequency of that substance into the liquid. And it's done by succussing. So originally this was done with tapping the remedy against a leather-bound book. So that was traditional. I'm sure in the processing now it's automated. But when I'm mixing up remedies in my office, I will just tap it against my hand or against my leg to succuss and release that therapeutic energy into the water. And then what goes on once you make your potency, so whether it's 6C or 6X or 30C, whatever it is, 200C, and it goes up there, there's higher potencies for the layperson using remedies. You do want to stick with the X and the C's, and you don't want to go too high, and I'll talk about that in a second. But the tincture, or the liquid, the substance in the water, once it's made to the dilution, is put onto sugar pellets or lactose tablets. It's put into alcohol or glycerin tinctures, into creams, gels. So I've got a few things here. This is a gel that has arnica in it, as well as a number of other things for musculoskeletal injuries. Here is tablets that are 6X. Whoop. And I held up some pellets with the Ledum palustra. That's a 30X. I just grabbed some, and I don't know. Oh, did I grab a C? Here's a mixture for sore throat. So this has a number of remedies in there. Here's a nasal spray. That's a homeopathic remedy for allergies. Here's a liquid tincture that is, this is actually a special type of homeopathic remedy actually containing thyroid gland in there. And at some point I will talk about sarcodes and nosodes and miasms. This is just the 101. We're getting to the basics. So I don't want to confuse you too much. And here's a spray for the throat. So you can find these mixed remedies at any health food store. If you can't figure out which single remedies are the best. If you can figure them out, it does take some work to do that. There's a whole repertoirization that I go through. It can be like an hour-long process figuring out which single remedy, and it is the best for healing modalities. But if you're having trouble doing that and you can't find anybody to work with, well, first of all, you can call me because I can do this over the phone or over FaceTime or Zoom. Simple enough, but you can always try one of these multi-remedies first. All right, how to use homeopathy. So the law of infinitesimals, yay, I said it. So the higher the number, the more the dilution, the more potent. So you may think, wait a minute, there's less substance in there and it's more potent. Yes, because the therapeutic energy infused in that is more. So the higher the remedy number, so a 200C, you would take much less often than a 30C. So I do recommend, if you are beginning with homeopathy, that you stay in the 12X or 12C or 30X or 30C range. Don't go up to the 200. Stay lower. You can take that more often. And if you're not having a result, or if in the end you end up proving the remedy, in other words, the symptoms get worse, then you really do want to work with a homeopath, especially if you have a very serious condition. If it's just, a simple cold or flu or something like that, not such a big deal. But if you have a really chronic condition you're working on and you really want to find that right remedy and the right potency, I do recommend working with somebody. Now, when you're taking these remedies, do not touch them if you're taking them orally. So some people will just dump them in their hand and throw them in their mouth. No, you want to put them in the cap. And so you can just, put how many that you want in there, pop it into your mouth without touching it, and stick it under your tongue and let it dissolve. If it's a sugar pellet, you can chew them a bit and just keep them in your mouth. Best to be under the tongue if possible. And for kids, they may chew it. That's okay. It's not going to hurt them if they chew and swallow rather than sticking it in their mouth. But if you can, try to get them to hold it in there. You don't want to eat, drink, brush your teeth, or have anything in your mouth 10 to 15 minutes before you take a remedy orally, because it is an energetic remedy. And if you have anything else in your mouth, just like touching it, you're going to affect that therapeutic, energetic process that is going to go on. So you also don't want to take it right away with essential oils and herbs. Same thing, wait. You want to keep your homeopathy in a dark, cool, dry place. I use my second bathroom that we don't shower too much in, and inside the medicine cabinet, and I just have my homeopathy in one cabinet. There's no other herbs or oils or anything else in there. If your symptoms aren't resolving, you're not using the right remedy. That's it, full stop. When people say homeopathy doesn't work, it's because they're not using the right remedy. That's it. So this is when you may need to get some help if you're having trouble figuring out which remedy is the best remedy. Again, if the symptoms increase, you may be proving the remedy. If you're taking too high of a dose and too often, I should say, then just stop taking that remedy, back off, and get in touch with a homeopath to help you out and make sure that you're taking the appropriate dose. So like I said, who can use homeopathy? Really anyone. Pregnant women, women trying to get pregnant, you don't have to worry about side effects. Same thing with babies and children. You're just going to lessen the dose. With babies, I use liquid tinctures that I mix up with pretty much no alcohol in them. And I just have the parents sort of squeeze the lips together to make a little hole there and drop a few drops in there. Very, very little amount is needed. Older children can take a higher dose more often, but it's, again, very safe. There were instances when my kids were growing up, because I had some homeopathy on hand just in case to have it in my toolbox. And I would go to get, let's say, belladonna if they had a fever, and there'd be nothing in there because they'd go in to the homeopathic cabinet and just open the top and eat the pellets because they're super sweet. So I would just get mad because I wouldn't have the right remedy when I needed it, but I wasn't worried that something would happen to them. All right, a little bit on research in homeopathy. There's been a number of randomized controlled trials done, and there's been really great outcomes of 85% showing that homeopathy is more effective than a placebo. They've grouped some of these studies in the meta-analysis, so they've looked at large groups of studies and showed that homeopathy, for the most part, works better than a placebo. There are actually homeopathic hospitals that's, at least there used to be, just using homeopathy. And in 2005, there was a 6-year study at the Bristol Homeopathic Hospital where 70% of 6,500 patients experienced health improvements. And then even Prince Charles commissioned a report to see how homeopathy was helping people in England, and there was a 30% GP consult drop and 50% savings in prescription drug costs. There's also the Homeopathic Research Institute, which is dedicated to research in homeopathy. And, you know, a little note on that, it's really more difficult to do placebo trials, randomized trials with homeopathy because it's individualized. And so I feel like these studies looking at the clinical aspects are way more informative because let's just say you're using ferrum phos or belladonna for fever, and that person isn't fitting that particular profile, well, it's not going to help them. So it is a little bit more difficult than using, say, a drug, because usually with drugs, it's a one-size-fits-all. All right, we're almost done, guys. Herrings Law of Healing. I wanted to just touch on this topic really, really quickly. Constantine Herring was one of the founders of American homeopathy, so it started over in Germany and made its way over to America. And what he noticed when he was working with patients was that as people cured, they cured from the inside out, top to the bottom, and also in a chronologically backward sequence. Well, what does this mean? So let's just say you had an injury. Let's say you injured your knee when you were 5, and the pain went away, and you thought, oh, it's healed. But let's just say then you started having chronic issues, maybe with your low back or your hip, some other part of your body that's related in the kinetic chain for the knee. And I've seen this too in my chiropractic practice, and in chiropractic we call it retracing, where I'll start to work on the issue the patient's presenting with. And as I go through the healing process, the knee, I'll work on, let's say it's the hip, the knee pain comes back, and they're like, what? Wait a minute. I, had knee pain, but it went away, and am I getting worse? And I'm like, no, this is actually really good because we're going back in the timeline of history and going back and actually healing the knee pain, which preceded the hip pain, because it's all related. So the same thing goes on with homeopathy. So old problems oftentimes resurface as you are working on healing the current issue. And if you give a dose of the remedy that you have found to be helpful with your current issue, it should clear up this past trauma so you can actually truly heal. And this is, again, coming from the inside out and chronologically from the present to the backwards way in time, all the way back. So pretty cool. And just a note on that, because again, as you start healing, you may notice these things will pop up. All right, that's it for today. You can find me at losangeles-chiropractor.com. That's my website. It's the best way to reach me. I am a doctor of chiropractic. I do have my diploma in homeopathy from the British Institute of Homeopathy. I'm also board certified in Chiropractic Pediatrics and Pregnancy and in Childhood Developmental Disorders. So there's a plethora of different things I can help people with, either in person, or there's a lot I can also do remotely. So feel free to reach out to me if you would like to work with me, or if you have any questions. I would love to hear from you. All right. Have a great evening, and I will see you here next Tuesday on my YouTube channel, Dr. Christine Anderson, Chiropractor. If there are certain health issues you want me to talk about, please let me know, and I will see you next time.